Singapore is bracing for a wave of Omicron cases, which might be bigger than the Delta variant. Authorities say it could possibly see up to 15,000 daily cases in a worst-case scenario. But the country's pandemic task force says it remains committed to living with the virus. Preliminary data suggests that although the Omicron variant is more transmissible than the Delta one, it's less severe.
We have so far accumulated 2,252 Omicron cases. Out of the 2,252 cases, 3 required oxygen supplementation, and all have been taken off oxygen within 3 days. So all 3 are now recovering. None has required ICU care as yet. So if these same 2,252 infections had been caused by Delta, based on our experience, we would expect about 30 individuals to require oxygen supplementation, ICU, or die.
As the Omicron variant is less severe but more transmissible than the Delta one, Singapore will try to ride it out without changing the existing safe management measures. So this means no easing of measures ahead of Chinese New Year. Well, the task force is taking a precautionary stance given the recent impromptu New Year's Eve celebration at Clarke Quay, which it has identified as a potential super spreader event.
Chinese New Year may be a time when Omicron cases are rising, so we cannot afford to have more super spreader events taking place during that time. And therefore, we would like to encourage and urge everyone to continue exercising personal and social responsibility and to comply and cooperate with all the safe management measures.
Or to prepare for the upcoming wave, the task force has laid out measures encompassing tightened vaccination policies and enhanced healthcare protocols. Sherlyn Sia with all the details.
COVID-19 booster shots will soon be required for those aged 18 and above to maintain their fully vaccinated status. The new rule kicks in on 14th February. Those eligible should get their booster shot 5 months after their last primary vaccination jab. To ensure an optimal level of protection, this booster has to be done no later than 270 days after your last shot, or your fully vaccinated status could expire, and this will affect entry into vaccination-differentiated places like malls, restaurants and libraries, for example. With community cases expected to rise amid the coming Omicron wave, the task force is also urging parents to get their children vaccinated.
We expect to see more children being infected. And rather than deal with the pain of seeing your loved one, your loved child being infected, I urge all parents to accept the invitation to register your child for vaccination at any of our vaccination centres that cater for childhood COVID-19 vaccinations. Don't leave things to the last moment, thinking that you can wait until you see a surge of community cases come up before signing up. The Omicron variant is highly infectious, and you may find yourself overwhelmed by a large number of cases in the community over a short space of time.
Singapore is also enhancing its healthcare protocols. Primary care doctors will get more discretion in deciding whether COVID-19 patients with mild symptoms should recover at home or in healthcare facilities, and for what duration. Previously, doctors would initiate Protocol 1 for their patients after testing them via both ART and PCR tests. Patients would then either recover at home or in a care facility if home conditions are not suitable. They'll then be discharged after 10 days if vaccinated or 14 if unvaccinated. But from Thursday, doctors will also be able to initiate Protocol 2, where only an ART is needed to diagnose the COVID infection on the spot. The person will then need to self-isolate at home for at least 72 hours and exit self-isolation after they test negative. They'll then be given a 5-day medical certificate or longer at the doctor's discretion. The task force says the move will further empower primary care doctors to look after their patients. It also streamlines the management of COVID-19 cases, especially as Singapore braces for an upcoming Omicron wave.
Well, Singapore is providing necessary COVID-19 data to the US after the US Centers for Disease Control and Prevention updated a travel advisory for Singapore to level unknown. Health Minister Ong Ye Kung says this is because the US CDC is not aware of Singapore's surveillance test numbers.
Every week, we administer over 150,000 PCR tests. And that works out to over 21,000 PCR tests per day. Positive rates for these tests are under 2%. We also have 155 wastewater testing stations across the island. They are in housing estates, dormitories, nursing homes, etc. Only a very small handful are registering the presence of COVID-19 viral fragments. So we are sure that the incidence of COVID-19 in our community is currently low and stable.